Hello, and welcome back to a brand new episode of the MEM1 Mosaic podcast. My guest I have with me today is Dr. Pratima Singh. I'm so excited, Pratima, to have you on. As I just said before, not only are you the first psychiatrist guest that I will be speaking to, your passion for nutrition, I think, is really what stood out to me. And I'm so excited for my guests, my listeners even to get to kind of check in, I think, on something which isn't really spoken about a lot in the field of MEM1, but I know in medicine generally. So I'm going to let you take the microphone and just ask if you could maybe give us a little bit of an introduction to yourself and how you've got to where you are now.
Oh, with pleasure. First of all, Lizzie, thank you so much for reaching out and inviting me. We met at the trauma conference in Oxford, where I was doing a panel about mind, body, and integrative approaches to trauma. And yeah, I'm not surprised that you found there are so many strands that resonated. So, a little bit about myself. I am a consultant psychiatrist and I practice 3 days a week in the NHS. I decided a few years ago to go part-time, although I've been in psychiatry in UK for over 20 years. And in my other time, I am a functional medicine psychiatrist. And what that term really means, because it's an American term, is that we look at a root cause approach, root cause resolution, and going beyond the labels and really drilling down to what might have been the start of the illness for that particular person. So when it comes to functional medicine, there are no specialities, but because in UK specialist remain specialist, that's the closest term. And now, while functional medicine is quite detailed, there is only a limited part that I have been able to integrate in my work in the NHS. So, in my NHS practice, I have committed to making nutrition a part of every consultation that I have. And organically, what started to happen, I mean, I really don't know how it happened. I think back and ask myself, how it all began. But what has happened is that I have now given talks, CPD events, and training lectures to over 15 different NHS organizations in their training programs for everybody, going from medical students to psychiatrists to anesthetists to GPs. Literally, I always say, I'm ready to talk about this to anybody who cares to listen, because mental health patients with a serious mental illness die 15 years younger as compared to their counterparts. So if you have a diagnosis of schizophrenia or bipolar or schizoaffective, just by virtue of having that diagnosis, the mortality is reduced by 15%. And I always lament my field that if this was happening in cancer or was happening in any other condition, there would be an outrage. But I mention this statistic every time I speak because I want people to know that this is a reality that we have very passively accepted. So I think this is a hidden part of the stigma against mental health patients, that it seems this excess mortality does not create the curiosity that it deserves. So while we have, kind of robust systems about management, my interest from nutrition began that many of the chronic conditions that lead to this excess mortality are directly affected by lifestyle. Yeah? Even the genes that predict the increased mortality through, increased risk of diabetes or obesity or heart disease are turned on by particular lifestyle behaviors, of which nutrition is the key. So I very much believe what Hippocrates said, that you are what you eat. I also believe that food is so much more than food in mental health. That food is information. It literally is genetically packed information that we transport from the environment into our physical bodies and make it a part of who we are. So we have to pay a great attention when you have any chronic illnesses. And this is where I would like to speak to your listeners, that when you are living with a long-term condition, what you put inside your body, with food, with water, with air, with thoughts, is constantly creating, changing and, creating effects that will directly influence the so-called condition that you suffer from. So yes, so that's my journey so far. And we were talking earlier, in exploring this kind of connection between mind and body, what I realized in the last few years that there was something missing. I mean, I was always interested in nutrition, and as I dig further and further and further, and asked myself why even highly educated people with every resource affordable do not do what they know they should be doing. What is happening there? And this is where I would say my worlds collided. And I realized that there is something, even deep, and that is our connection, A, to ourselves, B, to the world around us, and C, to something higher than ourselves that really dictates how we perform in this dimension, or what I will call as a third dimension that we are incarnated in. So you could call it spirituality, you could call it a higher mind body soul connection. So that has been my other interest, which I feel very fluidly brings together everything about me. So that's me.
I mean, if your energy didn't already say it, just what you've shared there makes you such an interesting kind of charismatic person. And I have so many threads I want to kind of pick up and run with here. I think what's going to be of most interest, perhaps to MEN1 patients right now listening, is this idea of nutrition, of the interplay between gut health, mental health, and I believe as well physical health. Now, your field is let's say mental health psychiatry, but I think you'll probably agree with me when I say I don't believe that one can separate the mind from the body from the soul, and that's exactly what you've just gone and explained there. For someone who's never been exposed to a conversation which talks about the link between the gut and the brain and the nervous system, the endocrine system, which is obviously what MEN1 patients are interested in,
Yeah.
can you explain for us in a really simple way why on earth what I eat, what I put inside my body can have an effect on other parts of the body, if that makes sense?
Great question. Great question. And I love the encouragement to keep it simple because it is really simple. And the way I do this in my appointments is that I have a flow chart that shows people how serotonin is made. Yeah, serotonin, a happy hormone, a neurotransmitter, sorry, that we are trying to target with medication. Yeah, the whole science behind whether the medications actually do anything to the neurotransmitters or whether the neurotransmitters have anything to do with depression and anxiety is a different matter. But I use a flow chart, and my lovely secretary laminated it because she said, Pratima, I'm getting tired of you photocopying and giving away copies after copies. So she laminated it and said, ask your patients to take a picture. So that's what we do now. And what I try to represent, it's a complex flow chart, and the end point is serotonin. The starting point is tryptophan, which is an amino acid. Many of my patients actually believe that when they use antidepressant medication, they are getting neurotransmitters. Yeah? So we really have to begin quite basic. And I remind them that it does not, yeah, which is why it's a very common experience that people will find that, oh, they feel the medication is working and then it plateaus. And I tell them that what is possibly happening, we don't really know, is that the serotonin reuptake inhibitor medication are just facilitating movement of the serotonin from one area to the other area of the brain, which is, so if these are two nerve cells, there is a synaptic cleft where the serotonin is, and it is constantly recycled into vesicles at the end of your nerves. So this recycling is what is slowed down or stopped by these reuptake inhibitor drugs. So I said, that's all this medication does. So once it has recycled whatever is there, your body is relying on you to make the neurotransmitter. And that is coming from tryptophan. And my little flow chart has all the sources of not only tryptophan, but all the cofactors. And these are multiple vitamins, minerals, all sorts of things that move the cycle from one step to the other. So I use that to tell patients that, if you want my medication to work, I cannot do this without your contribution. Yeah? If you are eating crap, expect to feel like crap. Yeah, you can edit this out, but this is literally an acronym I use because the CRAP stands for carbonated drinks, fizzy drinks. R is refined flours, so white flour, ultra processed, flour based products. A is artificial sweeteners and sugars, and I club them together. I'll explain why. And P is processed food. UK consumes more processed food than anywhere else in EU. 40% of all the food we eat comes in the category of processed food, and processed food has got a range of processed and ultra processed. So a processed food is how far it has come in the process of manufacturing, that is stripping it of some essential nutrients, mainly fibers, but many other nutrients. US is the largest with 60% in the world, but Portugal is 10%. We also have the highest rate of child obesity. We also have the highest rate of many chronic illnesses, worse cancer outcomes that you might be aware of. So the question for me in my clinic is that if the brain is not nourished, through essential nutrition, through building blocks of the neurotransmitters, through a healthy gut and brain communication, yeah? If an inflamed gut is constantly giving signals of threat to the brain through the vagus nerve, the brain is going to remain in a fight or flight state or an inflamed state. So we now know that depression has been shown to have some kind of links with a low grade inflammation. Yeah? So this is not the kind of inflammation you get a swollen knee or a shoulder. This is a more low grade burning fire that is just as problematic because it consumes a lot of energy, it consumes a lot of our nutrients. So I find that when people eat poorly, they not only not nourish themselves, so we are in a state of chronic malnutrition, even though we might be overweight. We are overnourished, but malnourished when it comes to the nutrient, but consuming excess calories. But we are also inflaming our bodies. Yeah, so it is. So my approach in with nutrition is two-pronged. A, how to stop the self-sabotage by spending good hard-earned money on getting things that is actually going to harm your health. And for me, this is very much the starting point. But I never ask patients, okay, this is the ideal diet, start eating. We start to slowly look at what they are eating. So with every patient I see in my clinic, I do a 1-day food diary just to get a snapshot. It makes the conversation very personal. I could tell you, eat 5 vegetables a day. Most people think they do. But when I ask you, tell me everything you have eaten or drunk yesterday from morning to the time you went to bed, you'll probably find it quite easy to remember, but you won't remember what you have eaten in the last month. So getting the information very specific. And second, I start with a blood sugar chart. I tell people, roughly based on what you have told me, this is what I would expect your blood sugar fluctuations to be. Now, the blood sugar regulation is a very important issue for your patients. Bone health is, very important for the Men One community. So if you are having excess of inflammatory foods, this is going to deplete some of the fundamentals of your health, and we build the conversation from there, and we try to tweak this to as much as possible to a Mediterranean diet plan. Now, although I use that diet plan as a goal to work towards in my NHS setting, in my functional medicine, it gets much more sophisticated because we do food intolerance testing, gut microbiome testing, nutrient testing, etc. So yeah, that's roughly why the whole conversation happens about nutrition in mental health.
It's amazing. It's absolutely fascinating. And there are so many, I was about to say buzzwords. I don't think they're buzzwords, but I'm going to say keywords that have jumped out, which are just going to land so well with an MEM1 audience. Because in some ways, the listeners of this podcast are kind of at the, let's say, the initial stages of branching outwards from conventional medicine, you know, into gut health, into mental health, emotional health, and all of this. And so much of what you've mentioned here, I think, is going to give people just this kind of reassurance that yes, you know, they're starting down the right path, even if it's not something that they've heard before, even if it's not the kind of dominant narrative that is taking place. There was something that you mentioned about oh, I forgot. I I've written all my notes and now I've forgotten exactly what I was going to say. But that's what happens. This is how you know it's live. It was inflammation.
Yeah.
Um, do you believe that inflammation is probably at least the most kind of influential factor in chronic disease right now?
Um, I think inflammation has become the poster child. It was always there and will always will be. I do worry that the concept is oversimplified, which is why non-integrative or more conventional medicine has such difficulty, getting on board with the discussion. Is because much of this inflammation is not measurable by the conventional tests that you would have with ESR, CRP, etc. The other thing is inflammation is not never influenced by any single thing. There are multiple factors. So, two situations or two food products consumed by two different individuals, the outcomes in terms of the inflammatory markers, even very sophisticated inflammatory markers that you can measure, will be entirely different. So there is a complex interaction between your personal vulnerability, of which genes are extremely important. And I think this is where we have to really be respectful about our unique biology. And if Joe Bloggs does it and nothing happens, I can do it does not apply. You really have to look at your family history, look at your own health history, and how you have reacted to things in the past. But most importantly, listening to your body. Yeah. If most people kind of know, like I must say that it's very humbling, it's very grounding. My patients know everything. They teach me where to go, and they shine the light where they now need my help. They often don't require me to give them aha, and anything that is too aha usually has a wow factor. It's hardly retained. I find the insights and the wisdom that the patient has arrived from themselves seems to be retained more, and this has really helped me because I used to be quite zealous, and I can get really excited and bombard and overwhelm the person with a lot of information because I have done a wonderful course 2 minutes ago. And my approach now is much more relaxed. It's really kind of exploratory. Okay, guide me. Where is the roadblock? Guide me. Where do you need help? So yes, inflammation is critical because what it has done is it has told us that this is the common underlying pathway towards many of the things that on surface might look very different. And this is exactly why functional medicine approach made a lot of sense to me. The main reason why I got attracted to functional medicine was it was the closest to the holistic approach to medicine that I was aware about from India, which is Ayurveda. Yeah, there was no modern equivalent. So when the Institute of Functional Medicine came up with a model, I said, yes, this would work. But what functional medicine approach tells us is that the common inflammation kind of enhancing lifestyle habits or genetic predictions might, according to your own weak genetic link, either manifest in depression or asthma or an inflammatory bowel disease. So, the change, the manifestation of it is very unique according to our genetic biology, but the underlying processes seem to be present in almost every chronic condition. So I think it is, but it's not as simple as that it's inflammation, because that is where we went wrong. We got sidetracked in conventional medicine and started to research. So for example, in depression, as soon as the depression having that inflammation as one of the factors was discovered, the next step was for the drug companies to find NSAID medication or antibiotics to quell that inflammation, and the results were not that fantastic.
This is really fascinating because I think there is particularly in kind of and the circles I run in, the word inflammation is everywhere. That really is a buzzword. And it's really interesting to sort of hear this slightly that kind of a nuanced view, I think. And it's actually going to lead me on to the question I was going to ask before I forgot it. Um, so in my experience, and I've worked on my gut quite a lot, and I believe that inflammation is in part to potentially contributing towards my experience with MEN1. I know that, well, put it this way, I went for years taking supplements, eating all the right foods that, the science was bringing back, that the blood tests were bringing back. And I had this kind of honeymoon, like, oh my God, I feel absolutely amazing. And I plateaued. And what happened was something again was missing. And you said that earlier, something is missing in terms of connection to self, connection to the world outside of us, and potentially connection to something up above. And obviously, granted, not everyone's going to believe in that necessarily. But I certainly do. And all I know is that it wasn't until I started working on myself, and by when I say myself, I mean my thoughts, my emotions, my beliefs, quite literally my kind of what I call my internal world. That's when really the changes started happening in my health. So that's when I started bucking trends in MEN1. This is going to probably sound so alien to, again, a patient who has maybe only ever had experience in conventional medicine. And a bit like you did before earlier with nutrition, are you able to explain why what is going on up here can affect what's going on sort of below the neck, if that makes sense?
Absolutely, absolutely. And I love the example you shared from your own experience and the shift, because I have found that about myself too. Um, See, I mean, we are in the end of December recording this. We are in the holiday season. Lots of people starting from January will go on diets, etc. It is the energy behind our efforts. It is the frequency of the energy behind our thoughts that lead to our efforts, that dictate the outcome. So you could be doing the same thing with feelings of desperation, frustration, hating your body, looking at your body as something that's really coming in the way of you living your life, etc. And you could have the perfect diet, a perfect schedule. You could be the best health hacker. And in my practice, I certainly seem to attract my share of health hackers where the soul is completely absent. And my job there becomes to show them that the quality of what is pushing them is inherently negative. It is fear-based. It is disconnected. People have gone so deep into this health hacking that they have lost connection with life. What brought them joy before they became ill with the key people in their life. They become addicted to scrolling reel after reel after reel about their condition. So their focus really becomes quite imbalanced, and sometimes I get referrals from my colleagues asking to enhance their protocol, and basically my advice to them is, how about we give up this protocol for 3 months and go on that trip that you mentioned, or go on to do this. And people find that really difficult because they have come completely focused about the illness and the optimization. So taking a step back, in answer to your question, Lizzie, um, our thoughts are often the start. So it depends on what kind of a person you are. We all have different orientations. Some people are very mental in terms of how stuff starts for them. For other people, it's emotional. They have an emotional experience which leads to a change in thoughts and then would have an influence on their action. I I find that one of the main things that I remind people is of the body. Yeah, and this has been a great learning for me as well, because I'm an extremely mental person. Most of my activity, analysis, thinking, bringing things together happens in my mind. So when you bring yourself into the body, and when I say bringing into your body, it is not in the 30 minutes of meditation you do, but being aware of, how the body is communicating throughout the day and through the process of whatever intervention that you're engaging in. So what we know, I mean, again, this is very difficult to study, but the trials that we have good evidence to show that when people, through something simple like CBT or through something more deep and exploratory like psychoanalysis or therapy, when people really address their thoughts and how their thoughts change, that can have an influence on their whole biology, because you give up, it takes away the energy. I don't know if you have experienced that. We can feel really attached to some thoughts, and a conversation happens, you find out some new information, or you have just had a good cry, you've had a chance to explore. When those thoughts lose that energy, they seem to lose the same impact on your body. So we know that thoughts itself can set up a cascade of inflammatory reaction throughout your body, just like being attacked by a virus. Yeah. So that is how powerful our thoughts are, and which is why I encourage anybody living with a chronic condition to not lose sight of their pie chart of life. Yeah, what their life is about. Yeah, and this is something that I do from time to time as well. That if 90% of my energy is focused on something that I claim to be 20% of my life, which is work, then this is the time to stop and rejig that balance. Because of course I'm going to become a workaholic, I'm going to take that negative, but then all that imbalance excess energy is possibly also going to feed back in terms of difficulties, conflicts, burnout, etc. So in terms of the body and mind, and this is not superficial psychology, this is not like positive thinking, it's something more deep, that when you hit the plateau, when you're doing all the right things, that is a great time. I think even so greater if you start right from the start. I think the first step of doing any health intervention is coming in your body. Yeah, becoming really aware of how you are in your body, how you occupy your body, using your breath to climb down into this body, becoming aware of the spaces that you occupy, don't occupy. If there is pain, how are you relating to it? Are you irritated at it? Are you able to see yourself with love and compassion? That needs to really be the place where the effort starts from. Without that, I feel people usually are very dissociated with what driving. It is usually fear in my experience, rather than I just love myself. I have so much respect for myself, and I'm going to nourish this as I would nourish a baby of mine. Yeah. How we nourish our very young children is the energy that we are trying to have for ourselves when we are creating health.
I love that. It's so beautiful what you've just said. And yeah, I feel very excited because I think, oh, I found someone who's reading off the same page. And I believe that there'll be many listeners with MEM1, perhaps even without MEM1, who'd be able to just take so much from what we've discussed today. And you've definitely helped me open up and look very differently at things which I thought I had covered before, but now you've given me a lot of kind of nuggets of gold, as I normally say. So I really appreciate that. Um, I'm going to squeeze in one final thing on the end, which is something I ask to all my guests, whether they are a patient or a professional. And in your case, as a professional, if you could kind of give guidance to, let's say, an MEM1 patient, but it really could be anyone who, as is the case, as was my case, has only ever had exposure, let's say, to the kind of traditional way of things, let's say NHS care, even though I have listeners based abroad as well, and who's wanting to kind of embark down this kind of mind, body, soul path, which we've talked about, nutrition, gut health, all that sort of thing. What kind of is the first step? What do you think is the first step for a patient?
Oh, wow, Lizzie, great question. See, I mean, aren't we so blessed that somebody living with this condition will Google, for example, and find your podcast? And we have 37 episodes to inspire them to think about. Yeah, imagine like in normal life to bring together 37 people with the same condition would, it's becoming rare. So I think we are so blessed that we have that exposure. But I would encourage people to specially explore the blind spots. I mean, that's what I have learned. I mean, there were times when I used to laugh at some of the things that were, kind of hearsay in my culture. And now those are the things that I am in awe of. And, I look back and I think, wow, like, in my 20s, I was laughing at these things. So I would say, if there is something that interests you will naturally follow, but if some things you have heard that you feel like that's just too alien, go in there because it is where our blind spots are that we will find treasure. And I think there are lots of good places to begin with. We have almost every condition now has so many online groups where you can meet people for those different perspectives. But if people were looking at more integrative works, the Institute of Functional Medicine does some really cool talks. I always mention Dr. Rangan Chatterjee and his podcast, Feel Better, Live More. He was instrumental in bringing me to functional medicine because, again, I respect Rangan so much for bringing together these perspectives, beyond diagnosis and really giving those examples of how we can enrich our life. But yeah, I will be more than happy for people to reach out to me as well if I can be of help in any way. But I think your podcast is a great place to start. I've really enjoyed dipping in and out of the talks you've had.
Well, thank you so much for giving your time so generously. I know that you are not very available, very free. You are busy, you have lots going on, but to have given your time over to help me and to help my listeners is really very special. So thank you very much. I'm going to include, for anyone who's listening back, I'm going to include Dr. Pratima's contact details in the description box, which is below this video if you are watching it. And just once again, thank you so much for your time and all the best with your practice going forward. And I'm really looking forward to staying connected and perhaps having you on again in the future if that's something you'd be interested in.
It's been an absolute privilege, Lizzie. Thank you very much. And yes, I think I'll be definitely be up for another conversation in future. Thank you.